Hi, everyone, and welcome back to the Nontraditional Nurse podcast. I'm Ellie, and today I'm joined by Kalyna, a nurse who has built a career in the world of nurse life care planning. So, thank you so much for being here with us today, Kalyna.
Yeah, thank you for having me.
So, this is a role I wasn't even familiar with. And so, most nurses might not have ever even heard of nurse life care planning, but it kind of sits at the intersection of healthcare and the legal system. So, I'm really excited to kind of dive into it today. So, today we'll look at what a nurse life care planner actually does, what that day to day work life looks like, and how nurses can start exploring this path. So, to start with, let's just go back to the beginning. Can you walk us through your nursing background and how and where you were led to become a nurse life care planner?
My background is at the hospital. I started in the operating room, transitioned into a dual role where I was like OR PACU trained. And I did that for 8 years. Um, Started life care planning, kind of like stumbled on it by accident. I knew somebody who reached out to me and asked if I was interested in a PRN position. Very low key, like I could keep my part time job at the hospital. And something I never heard of. She works for a consulting company and she was looking for a nurse to join her staff to review medical records and become a nurse life care planner. After going back and forth talking to her, talking to my husband about what this would look like, I did both at the same time, working in the hospital and then started like working on courses for the life care planning.
Yeah, that's awesome that you can kind of dip your toes in a little bit and keep your job in the other place. Make sure you love it. So, for nurses that might not be familiar with this role, let's like dig into it. How would you explain what a nurse life care planner actually does?
So a nurse life care planner reviews medical records. What we do is we work with clients. Mostly, my clients are the lawyers who have clients that have either had catastrophic injuries, who have long term medical needs, whether that is like medical malpractice, personal injury, could be, car accidents and those kind of injuries. So, what I do is review records and I kind of like put costs associated to lifetime medical care. So this includes medications, therapies, treatments, home health care, home accommodations. Um, what we do is like review the records, see what kind of like lifelong care that client is going to be needing, and associate costs to that.
Okay, so kind of projecting what their needs will be for the rest of their life after they've had some sort of catastrophic accident or something similar to that.
That is correct. Yeah.
Okay, so that's kind of the big picture. Now, what does like a typical day or week look like in this role for you?
Yeah. So since I'm PRN. I It's a flexible schedule and I work remotely. Um, a big part of my job is reviewing medical records. So there's sometimes thousands of records that I'm like, penciling through. Um, a lot of research, so researching standards of care and, standards of cares are always ever changing. So you're doing your research on like what's appropriate for, let's say, a client with a spinal cord injury, what's appropriate for a client with a traumatic brain injury. Um, I'm writing reports, editing reports, a lot of communication with lawyers, and we do like interviews with the clients before in the interim of me like writing and reviewing records. Um, so I don't have set hours. I work kind of on like a deadline workflow. So I usually get a deadline and my work kind of is super flexible.
Yeah, so in that sense, like work life balance, you could really probably take on as little or as much work as you want. Like, so this could be a part time job, a PRN job, or more of a full time gig if you were interested in that. Is that correct?
That is correct. But in my situation, I work for a consulting company who gets the
Hmm.
cases. So there are times where I go months without any work. There are times where I'm having um, 4 to 5 cases due in the next 3 to 4 months. And some of them are quick turnovers, some of them are not quick turnovers. Like I'm currently working on a case not due until August. So, I have a few months to work on that. Um, so, yes, somebody can do this full time, but also like there are times where we do have slow lulls.
Yeah, absolutely. And it seems like you could kind of decide the risk you wanna take too. Like, you could build your own business and market that and get cases yourself versus, like, working under someone in a consulting company. Is that correct?
That is correct, yes.
Okay, awesome. So you talked a little bit about this, but are there certain types of cases that you typically work on or certain types of patients you're creating these life care plans for, or is it different all the time?
Yeah, so my in my case, my life care plans are created for legal cases, for legal reasons. I work 50-50%, I would say, plaintiff cases and 50% defense cases. Um, and so I'm working with clients of all ages. Um, and I would say some of the things I have seen in my work are like traumatic brain injuries, spinal cord injuries, patients with chronic pain, slip and fall, personal injury cases. But the focus is always on clients who need long term medical care and what those costs would be.
Okay. And when we're talking about building the actual care plan, like, how do you go about determining what that patient needs long term or estimating the costs? Is that something you learned in your
Yeah.
certifications, or yeah, how do you figure that out?
Yeah, so doing a deep chart review, like you're picking out minuscule details in the chart. And I think experience from the floor helps with that. We do a lot of chart reviews there,
Uh-huh.
looking at the client's background, especially if they've been in a hospital recently. Um, so we look at like current needs and like where they are currently medically and then what their future would look like. I use like life care planning guidelines. I use physician inputs. I kind of look at the recommendations, nursing judgments. Um, and so those are kind of things that I pull from the medical records. And in my interview, looking at their current state and like kind of where they are now. Are they in physical therapy currently? How often are they in physical therapy? And kind of like figure how that would work in their lifetime needs.
All right. And when you are building your care plans, where do you actually get the costs from, or how do you estimate that?
Yeah, so my costs, I use specific databases such as Context for Health and Physician's Fee, um, like the most updated version. We use vendor pricing and regional pricing. So depending on where the client is living, we use that geog- geographical location to get the medical costs.
Okay. And you could have clients probably all over the country. Does it stay within the country?
Yes. So I want to say like my furthest client I've had was like Vermont. But yeah, so I've had clients out of state.
Okay. And then for those like databases that you talk about, does your consulting agency kind of provide membership to those, or is that something anyone can access?
So yes, there are fees to both of those databases, and my consulting company does cover those fees. But if you are wanting to do this position independently, that's something you can access yourself and purchase subscriptions to.
Okay. Well, it's great to know that you have some guidance and you're not just trying to come up with these numbers like out of nowhere. So,
Yeah.
thank you for that information. That's great. Now, you're a big part of the legal process, obviously. So, if that case were to go to trial versus being settled like outside of court, do
hmm
you have to get deposed or testify in court, or what might that look like?
Yeah. So I mean, knock on wood, I haven't gone to trial yet. I've been deposed twice with tentative trial dates. Both depositions have been on like virtual. One of the trials I think is supposed to be scheduled in person. So there is like a traveling, very small amount. I would say on average, like 1 out of 10 cases will go to trial. A lot of these medical malpractice and personal injury and the type of cases I'm working on, a lot of them settle outside of court.
Okay. And to me, obviously, that feels a little bit intimidating. And I'm sure, just getting into that role and thinking about that as a possibility. So, how do you feel like you prepare for something like that?
Yeah, so I'm not gonna lie, my first deposition, I felt went terribly. Like I was so anxious. Um, but working with the lawyers, they prepare you for those things.
Okay.
They have gone through it. They know what to expect and they're hiring you for this job. So they just want you to talk about what you did for them, this is how I came up with my reports. So yeah, preparing for them, I would say meeting with the lawyers is huge and great. Reviewing my records, and also like sometimes you'll get like a report of, so, like if I'm working on a defense case, like I'll get the transcripts of like the plaintiff's life care planner deposition. So, I am able to study those, look at those, see what type of questions they'll ask. And honestly, it's hard to prepare because you don't know the specific questions that they're going to ask you. But as long
Uh-huh.
as you know, here's the report I wrote, this is how I got to my opinions, and answer questions that way.
Okay, so really just being confident in your own work and, like, making sure that you have everything buttoned up.
Correct. Yes.
Yeah, and that makes
Yeah.
sense that you're working with the lawyers that hired you, so they want you to do, like, the best that you can do as well, so
Yeah.
that's nice to feel like you have someone on your team there.
Yeah. And then in the life care planning standards, you are writing a report thinking every case is going to trial. So making
Okay,
sure that that report is, well executed and accepted by the lawyers, it will be accepted by, like in trial, and being able to defend your opinions and what you have written in your report.
sure, that makes a lot of sense. Just like, I guess, as a bedside nurse, you need to have everything written as though, if there was an issue, you could defend your actions and charting and everything like that. So,
Yes, exactly.
so what skills from like bedside or clinical experience do you feel like are most valuable for this type of role?
Yeah. I think critical thinking, being able to pay attention to detail when you're reviewing medical records. Um, Time management is huge because I don't have set hours. So, being able to say, hey, here's my deadline. Here's how many hours like this report is going to take. How can I manage my time in doing these um, tests? Um, and just like anticipating, on the bedside, we anticipate the needs of our patients. I'm anticipating the needs of my clients long term. So, being able to say um, like medications, even like something very simple, like you're anticipating this client's going to be on a specific medication for the rest of their life because of a specific symptom or illness or something chronic that's going on.
Yeah, sure. That makes a lot of sense. So, probably a lot of literature review and learning about different types of illnesses or injuries that you might not have worked with.
Yeah, and that's where a big piece of like research comes in. You're looking at
Mhm.
standards of care, and you're looking at issues and like surgeries like you haven't heard of. So like going deep into like researching of those kind of things.
Okay. Do you feel like there's a certain type of nursing that is really well suited to this, or could any type of nursing background really prepare you?
Yeah, I think any type of nursing, we all have the same like basic training of like critical thinking skills, being able to anticipate those needs, like paying attention to detail. And I feel like a lot of us work under pressure anyway. A lot of this, I want to feel like say like a lot of my job is like case managing. I don't do long term case managing, but I feel like being a case manager might like be helpful in this position just because you're looking at like needs in the immediate future as I'm looking at needs in long term.
Sure. Yeah, it seems
So
like
I
case
feel like case
management
managing would
that
be
yeah,
a great alternative.
that that seems like a really good stepping stone into a lot of non-traditional roles, truly. Have there been any, like, big surprises, like, once you got into the nurse life care planning?
Um, the involvement of research. So like, in my everyday nursing, I'm not specifically doing in-depth research. There are sometimes, you would look up like medication classes or different, like those
Sure.
kind of things. Um, and like the detail that goes into the life care planning and like how long each report takes. Um, and you're just looking at a client over the lifetime and not just what they look like or how they are physically now, but how are they going to be for the rest of their life, and looking at the costs associated with those needs also. So you're creating a big plan for these clients, So yeah, I think that was like the biggest surprise of like how do you determine the needs of this client long term?
Yeah, and what an interesting perspective too. Just, going from the bedside, we see like a snippet, and I think we can get really jaded too by, seeing just a tiny bit of medical care outcomes when really, people do go home, live the rest of their lives, and we don't get to see any of that. So, yeah, I
Yeah,
feel like this is a really interesting perspective you get.
yeah.
So, you talked a little bit about certification. Do you need a certification to get started, or how does that exactly work?
Yeah, so I feel like so getting started, I took classes through a program, and then you sit through your certification. But I feel like anybody can go and learn about it, explore, find a nurse life care planner local to you, and reach out to them, see how they came about or how like their background was. I started in a consulting company that didn't have any other nurses on staff. Um, so going through the training program was very important for me because I didn't have anybody in the back end to kind of like teach me these things. So it was a lot of like
Mhm.
hands-on self-learning. But yes, there's a nurse life care planning certification that you can get, and then with that certification, a lot of nurses like open up their own businesses and they can, um, work that way. I work for a consulting company.
Okay. Is it mandatory to have that certification before you work on your first case to be able to do
Um,
that properly?
So it's not mandatory to have that. You have 5 years after the training program to sit for your certification. A
Okay.
lot of life care planners can work under other life care planners. I know the certification for life care planning is fairly new, but there are a lot of life care planners that have been around for ages. So I know like in the past there weren't certifications, but there was just classes and kind of like however many training hours that they did. So it all just depends on um, everybody's like trajectory of how they got there.
Okay. So if you don't have the official certification, you'd have to work with another nurse life care planner to kind of sign off on your work. Is that right?
Correct, yeah. Just so
Okay.
that it can be like justified in court.
Yeah, that makes a lot of sense. Okay, perfect. Well, what are some of your favorite parts about doing this role?
So it's fully remote, which is very nice. Flexibility in making my own hours, great home life balance. So if I need to step away for an hour or two, like I can. In the evening when my family is home, I don't have to be tied to the computer because I'm have set hours. So I think not having set hours is was a great like turn on for me.
Uh-huh.
Also you're still like using your nurse brain. You're still in a different aspect, but you're still analyzing medical records and having that like critical thinking skills like also I think is great. And then also not all the time do I get to hear how these cases end or where they end up or if they settle. But I think it's nice that like I can speak up for a client. I can make an impact on a client's life. There was a few times where I've gotten like feedback on like, hey, like we settled, thank you for your help. Like, it's nice when you get like that
Yeah,
small win, right?
totally. Some closure and like still being able to advocate for patients is huge. And I think what you talked about using your nursing brain is so true. Like with almost all non-traditional roles, you're just using it in a different way. But, depending what you enjoy, it can still fill your cup so much and you can still advocate and some of those things that we really love about nursing, but I totally appreciate, the remote lifestyle being great for when you have a family and everything like that.
Yeah.
So that's wonderful to hear.
And it's a great like part-time or transition position.
Yeah.
Just because like I am still able to have time to work in the hospital. I could work around my normal schedules and it's a nice work-life balance.
Yeah, that's a huge perk. Sometimes it feels so intimidating to like completely step into something new and not be sure like how you're going to feel about it. So it's nice to be
Yeah,
able to kind of go at your own pace.
yeah.
So on the flip side of that, what have you found to be most challenging about it?
Yeah, I think staying organized. You definitely need to keep very detailed, um I mean, you're going through thousands of medical records, so being
Yeah,
able to organize those and pick out the important pieces, I think that can be challenging for some people, especially getting started. I feel like I've gotten to a point where, like, my record reviews are getting a little faster just because 'cause I'm knowing what to look for and I'm seeing the same hospital records, like, come up again and again.
sure.
Um, and then, like, I think sometimes like an anxiety portion of, like, being deposed for the first time. And you wanna make sure your reports are accurate. You wanna make sure that your client is getting, because we're using these for legal cases, and that that what your report states is reflecting the needs of your client. So just the pressure for that, I think, are the biggest challenges there.
Yeah, and I'm sure, like, as you get further into the role, you get a little more comfortable with some of those things, but
Yeah.
alright, so how we like to wrap up all these interviews is what advice would you give to a bedside nurse who's, feeling curious about this role or kind of excited about this role? What would you tell them?
Yeah, that's what I would tell them, get curious, like,
Yeah.
look in your area, see if there are any other life care planners around, and check with their experience. What did they do? Um, how is their nursing background related to yours? And do your research. Your nursing, your bedside nursing skills will transfer over into any nursing role that you put yourself into. Um, learning a new, like, trying to train your brain, going away from bedside and going to a remote role as a nurse, you have to be patient. Be patient with yourself.
Yeah,
It's not a fast learning curve. You are going to, have some hiccups. There are going to be some difficult tasks to complete. But, like, once you get there, it opens a lot of doors, and, getting your name out there, building relationships, um, I think is very helpful in this role.
awesome. That's great advice, and I think it's something I think about a lot, and every transition that you have, you go from feeling like an expert to back to novice, and it's so uncomfortable. Nobody loves it, even though you think
Yeah.
some people, do it effortlessly, nobody's comfortable
Yeah.
in that, and you have to give
Yeah.
yourself a lot of grace as you kinda go through these steep learning curves, especially when you're shifting, pretty big industries, so,
Yeah.
yeah, I think being confident in your nursing is huge when it comes to that.
Yeah. And I think slowly transitioning into that. I didn't
Mhm.
start this and then abruptly left the hospital. I was still at the hospital, slowly transitioned into this role, and I think that helped, maintain some sort of, like, familiarity, but also not feeling like I am extremely novice because I'm still going back to my expert position.
Yeah, you get a little bit of
So
both.
yeah, yeah. So you're fulfilled at in the beginning.
Yes.
So yeah.
Well, awesome. Kalyna, thank you so much for sharing everything, giving us kind of that behind the scenes look at nurse life care planning and joining us
Yeah.
today.
Of course. Thank you for having me.
So, for our listeners, if this episode introduced you to a role you hadn't considered before or helped you see a new way to use your nursing experience, make sure you're subscribed to the Nontraditional Nurse so you don't miss any future interviews or career deep dives. And thank you all for being here. We will see you next time.